coinsurance. Okay, so for Part A, so hospital. So hospital, the coverage in the hospital is nothing for days 0 to 60. But days 61 to 80, you pay a coinsurance amount of 408 for that. And then you can read as well as I can of what the additions are. So hospitalization, Part A, is free up to 60 days in the hospital. And past that, you do pay a coinsurance amount. And then Part B, you pay assigned claim. This is the 20% that Part B doesn't cover. You pay this unless you have a supplemental plan. Incidentally, the supplemental plans out there could cover this 20%, and it could also cover days 61 plus in a hospital. That could cover as well with a supplemental plan. Unassigned claims, 20% of approved rate, balance of actual charge. So, if you do have a doctor's bill that's higher than what Medicare can pay, you can go to a doctor that charges more, but you would be obligated to pay that addition. Okay. All right, Part D coinsurance. Again, there's the $545 deductible. And then 25% of drug costs after deductibles have been paid is what you pay until you get to an out-of-pocket amount of $8,000. But just be aware that drug plans, they vary widely. And I had mentioned before about always going in and making sure each year you check to make sure in the open enrollment period, okay? That's after you're on Medicare. There's an open enrollment period because carriers very well know that your health care could change. So you have the ability in that open enrollment period that runs about October 15th to December 7th. You can change your drug coverage because your drugs may have changed, okay? But make sure that you shop it because they do change. They do change. And it's so important to find the plan that works best for you and your wife or you and your husband. So, okay. What Medicare covers? Well, hospital, 100% of the first 60 days. Doctor's visits, 80% of the Medicare approved amount. And then some preventive services are covered as well. What does it not cover? Well, long-term care. That's purposely at the top of the list because without a good plan in place, long-term care could really catch a family off guard with what the costs are for long-term care. And I assist folks figuring that out and what might be a good long-term care strategy in their world, in their situation. Care delivered outside the U.S., not covered by Medicare. Dental care, vision care, hearing aids, cosmetic surgery, acupuncture, amounts over the Medicare approved amount, amounts not covered by deductibles and coinsurance. So, I mean, it's, hearing aids, they are not inexpensive. They're costly. So it's important for folks to know kind of what's not covered, what private insurance may or may not cover it. So deductibles and coinsurance amounts, such as for Part A. Now, remember, I said Part A's deductible was a little over $1,600 per spell of illness. That could be a big deal. That could get covered. Hospital costs after 60 days, the 20% of doctor's bills, etc., prescription drugs, the deductible, maybe the deductible can get covered. So, and that's where these Medigap policies come in. This is why you would have these policies to cover that 20%. Again, they're sold by private healthcare companies. So when you hear that term private, what do? You can shop the coverage. There are multiple carriers out there who offer supplemental coverage. New Jersey, I think we have, 10 or 12. In New Jersey, I think we have 26 different prescription drug plans. So it can be overwhelming for folks. Again, they're sold by private insurance companies. They supplement original Medicare, Part A and B. They follow federal and state laws to protect you. So to give you an idea, they're standardized. Okay, so if you have a Part G, Plan G, they're called plans in the supplemental world. So if you have a Plan G from United Healthcare and you have a Plan G from Humana, both plans will cover all of the same thing, but what each carrier charges you the premium. That'll be different. Okay. So they're standardized, they're identified in most states by letters. If you live in Massachusetts, Minnesota, Wisconsin, their plans work differently. I don't spend, I'm in New Jersey, so I don't spend a lot of time on discussing those differences in those plans, but just be aware if you're in those states, please consult with a health insurance guy in your state to help you with that. Does not work with Medicare Advantage. So you don't need a supplemental plan if you have an Advantage plan. And the reason for that is that because there's no 20% that the doctor coverage doesn't pay. What happens with Advantage plans is that, well, it's coming up. I'm not going to get out of turn here. Does not work. I'll cover that in a minute. You pay a monthly premium. Costs vary by plan company and location. So this gives you an idea. I tried to do a little summary chart on the Medigap plans. So I mentioned a plan G. You see that there's a whole bunch of 100% in there. F is no longer available. They discontinued F. There's no E. I've had people comment, hey, what's plan E? There is no Medigap plan E. But these are the different plans you can sign up for. And that's kind of how they cover. You might, as you might imagine, the more the plan covers, the more expensive that plan will be. Okay, but these are the different plans. I help clients kind of figure out what's best for them all the time with these things. And then Medicare Advantage plan. So health plan options approved by Medicare, also called Part C, run by private carriers. Again, shop these plans. Medicare pays amount for each member's care. You may have to use a network of doctors or hospitals. By the way, that's a good thing and a bad thing. It's a good thing that they pre-negotiated the rates with these hospitals and doctors. It's a bad thing if you have a need to go outside that group. I'm asked all the time, what's better? But you just kind of have to consider, what is your health situation? I'll tell you right now, if you travel a lot, then an original Medicare may be better than an Advantage plan for you, because the Advantage plan is normally geographically centric to where you live. So if again, I'm in New Jersey, but if you're traveling to Texas, you may have a coverage problem, although you probably would have the ability to get back to Jersey for any serious issues. May have to use that network. Plan may include prescription drug coverage. That's another benefit to the program. You could have prescription drug coverage included. May have extra benefits like vision and dental included. Benefits and cost sharing differ. So the Medicare Advantage plans, essentially, if a doctor takes an Advantage plan, you basically could sign up for them. By the way, not all doctors do take Advantage plans. They could basically say that they have had their fill and not take any additional Advantage or Medicare folks. My experience has been if you currently have a doctor and they've been your doctor forever and you move over to Medicare, they will continue to take you as a client because you've been with them. That's just been my experience. Shop carefully for private insurance. Medigap policies are standardized, but premiums vary considerably. I had mentioned, a couple of carriers, Mutual of Omaha has been in the business forever. AARP United Healthcare, they've got a nice supplemental plan. Humana's got a nice supplemental plan. So there's a lot of carriers out there, but they vary quite a bit in the price they charge. Drug plans, same thing, can vary quite a bit. Make sure you shop that prudently. The Advantage plan, again, that's the third area where private carriers are involved. So that's really kind of the areas of focus that I would have. Okay, planning for higher costs in retirement. Let's take a look at that. So out-of-pocket healthcare costs. So you can see as you age, and this is what this chart is meant to show, as you age, your need for services, which is the rust-colored, versus your premium costs, your need for services elevates. These are men. These are women. So you can kind of see what's going on as you age. Your need for services elevates. And once you have, a heart issue or a hip issue or a knee issue, it tends to elevate the cost of services for you.